Hi, I'm Debbie. I'm 50 years old, just turned 50 in the summer, and during the last couple of years I've noticed that my face with the ageing process has become a little shallow, quite sunken, and it's given me a bit of a complex. I hope that by having some fillers put in, it'll enhance my looks. It will actually help with my confidence, and I'll just feel a lot better with myself.
Today I'm going to be doing a Y lift, which is a cheek augmentation, which is the top of the Y, correction of the nose to mouth lines to soften these, and lifting up and tipping up of the angles of the mouth and improving the jawline. So the Y here will all be improved with facial filler injections. So what I'll be doing today with Debbie is addressing the fact that she's lost some volume in her cheeks, as we all do as we get older, and that has the impact of looking as if the face has dropped down. So what I'm doing now is I'm just going to mark out on Debbie's face where she's lost the volume. And in fact, what I'll be attempting to do, or trying to reproduce, is not a pillow face look. It's not to overblow the face, but to just look like we do when we slightly smile. It tips the cheeks up and makes the cheek volume look fuller, but naturally so. And it's in this triangle that I'm sketching on the face where Debbie has lost that volume. So by just lifting that with a little bit of facial filling and just subtly softening the nose to mouth lines will generate a lifting effect. So what we notice as we get older, particularly in women, is that the jawline becomes a bit softer, becomes slacker, and particularly when we look down there's a little bit of soft tissue to the lower part of the jaw. What I'm going to be doing is putting some filler in here at the sides of the mouth, what we call the marionette area, and that will prop up the side of the mouth and help prop up the jawline. So the effect will be a sharper, more clearly defined jawline area. So what I'm going to be doing is just starting to subtly and very gently tilt up Debbie's cheek where she's lost a little bit of volume. So this may look a little bit uncomfortable, but actually you'll see from Debbie's face that it's quite a comfortable procedure. And I'm putting the needle, I'm using a very fine needle here, and I'm using a product called Restylane Sub-Q, which is designed to volumize the cheek area in particular. I'm gently just going to start injecting. It is a little bit stingy. Are you all right there, Deborah? Do you feel okay? And very slowly start to inject the product. And this is going into a very specific part of the face. It's going very deep. Again, which suggests it might be a little bit uncomfortable, but it's not. It's perfectly tolerable. The patient just experiences a little bit of mild stinging. How does it feel? Does it feel a little bit stingy?
No, it's fine.
You okay with that?
Yes.
Okay. And this is one treatment, funnily enough, that can be done without anybody really noticing, because it does not tend to mark at all. So what we've done here is restore the cheekbone area. So from the side, it looks as if that the cheekbone has been restored. It's a little bit obvious when it's first done, so it looks a little bit harsh, but over the next couple of days, it will smooth out so that it looks completely natural. So what we're going to do now is soften the nose to mouth lines and tip up the side of the mouth, so the whole look is one of lift. And not dragging the face down, which can happen as we get older. This is a very straightforward procedure. Again, I'm using Restylane. Just gently going along the nose to mouth line pretty quickly. This is actually very comfortable. It's not unpleasant in any way. You can see that Debbie's face here now is coming down. If anything, by lifting these parts here, it's made this more obvious, the fact that Debbie's mouth is turning down. Again, anything that turns down tends to be aging. So what we're doing is just correcting this downturn. It's a very, very, very straightforward procedure. Can you see how that mouth tipped up at the corner? When I just tidy this up a little tiny bit, you'll see that quite clearly. And what we do is we massage this in. Just open your mouth, Debbie. A little bit of massage, just to blend the material into the skin. This is Restylane is a hyaluronic acid. And hyaluronic acid is what the vast majority of our skin is made up of. It's made up of collagen and hyaluronic acid, and it's a sort of very hydrating molecule that hydrates and plumps from within. So that's why it's an ideal facial filler, because it just lifts the skin very naturally. So what Deborah has on this side of her face is an indent here, which she's had when she was very young, and as she's aged it's got more apparent, and this is often where the tear duct runs and it creates a little depression or a little hollow. That can be quite difficult to correct completely, but with a cheek augmentation it will look softer and it will improve. So you'll see that when we do this procedure. So what I'm going to do now is just start to work on this side of the face and very, very gently correct this side. Using Restylane Sub-Q, which is used to volumize. It's a thick product, or relatively thick product, and I'm using one insertion point only, and this is because as we go into the skin we find a very specific plane in the skin where we need to put the product. It's exactly where there's a fat pad when we're younger, and we can feel when we're in the right place. It's something we just know we're in because there's a little bit of loss of resistance to the injection. So I can feel here as I'm injecting, it's gliding in very, very easily because I'm in the correct space. Y-lift treatment will cost between £1,200 and £1,500 and will probably need to be topped up at an additional cost of possibly about £500 every 6 to 9 months or so. Now that the treatment is complete, you can see that Deborah's cheeks have got a lovely natural curvature, which you can see very clearly from the side, which is very rejuvenating, and it takes very little basic aftercare. All I'm going to ask Deborah to do is gently massage the area upwards when she cleanses her face, starting from tomorrow morning, just twice a day, very, very, very gently, for all of about 20 seconds. Gentle massage down here at the same time, just again for another 20 seconds, just for 2 or 3 days, and that is it. For the rest of the day, I would just ask her to stay off any makeup, but apart from that, there is no other specific aftercare.
Oh, I'm so pleased. I really, really am pleased. I can't wait to put my makeup on. It's fantastic. I'm so pleased. Really happy. Really happy.